Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about dental sensitivity or hypersensitivity after your scaling or oral prophylaxis appointment. Let's start. So I was going through the comment sections and I saw a lot of people kind of getting angry over dentists after their oral prophylaxis or scaling procedure. Why? They said that ever since I've gotten my scaling done, my sensitivity has increased many-fold and it's not going down, and I feel that my teeth have been ruined. So I'm going to address this problem in this video. Now, the only thing that I'm going to start off with, that the possibility that the dentist has spoiled your teeth is very rare. I am not trying to say this as a defense for my community, but there are a lot of causes as to why you might feel dental sensitivity or hypersensitivity after your oral prophylaxis. The first and foremost cause is that you are already a patient of periodontitis or gum disease, which could be because of the fact that there is a lot of deposits, plaque and calculus and tartar stuck to your teeth, which has occluded the dental tubules and is covering it, that there is gingival recession and there is root exposure. The main cause of dental sensitivity or hypersensitivity is the exposure of the dentinal tubules that are present in the dentin, which basically have a dental fluid, and that fluid is actually kind of connected to the pulp and the nerves. Once this fluid starts vibrating or movement as per the hydrodynamic theory, that's where you come to know that there is some sort of dental hypersensitivity or sensitivity, and this only happens when that there is some sort of dentinal tubular opening. That means there is exposure of the tubules because of acidic drinks, because of the fact that you are having faulty toothbrushing, you're brushing very vigorously, because of the fact that there was plaque and tartar deposits over your exposed root, and that that root actually has been cleaned and planed, and all the instrumentation that has been done, now the dentinal tubule has been exposed and now you're feeling that. There could also be reasons such as that you had a lot of gingival inflammation, because of which that the gums had kind of surrounded the root surface at that point of time, and it was masking the sensitivity. And once the gums have been cleaned, they have been instrumented, the gums shrink, the root exposure happens, and then you get exposure of the dental tubules. Mind you that there are three layers in the crown of the tooth, that is enamel, the dentin and the pulp, and in the root there is the cementum, the dentin and the pulp. The cementum does not have enough abrasion resistance, so it can be worn off very easily by faulty toothbrushing or severe toothbrushing or prolonged toothbrushing. So it is not as abrasion resistant as enamel, and that's why there is a lot of exposure of the root substance in the dental tubules very easily, especially in cases of gingival recession and periodontitis. Now, coming to the question being, is your doctor responsible for the hypersensitivity? Not so much. There are other causes which I've already talked about, such as root exposure, such as periodontal disease, such as plaque and calculus, and tartar, covering the thing. A lot of people who chew smokeless tobacco, it has an abrasive and an occluding effect on the dental tubules. So what happens is, when you come to our facility and you've had years and years of stains, and we have to remove the stains for whatever reasons, even if it requires a sandblast or some sort of a prophy paste and all those things. Now, because of that, because of the instrumentation, because we want the teeth to be clean and be rid of the stains, there's a high likely chance on a microscopic level, yes, I will give that much benefit of the doubt to you as a patient, that there might have been more exposure of the dental tubules. But you don't have to worry about it, because of the fact it's very simple, that usually this dental sensitivity or hypersensitivity is actually very transient, and it goes down by a lot by the 1 week or 2 weeks to follow. And we have to find out the cause. Now, what happens in most of the cases, then when patients end up getting sensitivity, they don't go back to the dentist telling them that they're getting sensitivity. That is where the knowledge gap comes in. You need to go back to your dentist, tell them what is happening. They will do an examination, they'll do some tests, they'll do cold tests, they'll do probably air blast tests, they'll do probing tests and all those things, and they might give you over the counter desensitizing agents which might help you. They'll counsel you at the time as to what is the reason, because of gingival recession and root exposure it has happened, because of faulty toothbrushing. So they'll tell you what the exact reason and how you have to do the toothbrushing correctly. In the extreme cases, if it doesn't go down, we might have to go for gluma desensitizing therapy or laser desensitizing therapy, and in some very rare cases we might have to go for gum graft procedures, so that the gingival recession can be covered. Now all these things matter on two things: whatever instructions that you've been following, that is very important, how you are cleaning your teeth after the instructions. If at all you have been apprised about the fact that there could be transient sensitivity in your teeth after your periodontal procedures or anything of that sort by a dentist, because the moment a dentist creates that transparent platform where we tell you, in our facility this is what happens, that we actually make sure that we are informing you of the possible side effects of scaling and all those things, and then we go about it, and we do identify some teeth that might be susceptible because of gingival recession and all those things. So this is very important, and that's where the confidence and the rapport between you and us, basically it builds, and then you understand that it is transient, and even if it's not transient, if it's not going down, and if it's going down or not, whatever it is, you come back to us, we'll find a solution for you. And even if it requires a gum graft surgery later on or something, we'll do it. That's not a problem, because once the problem is identified, half the problem is solved. So all you have to do is, you don't have to hold back, you don't have to hold any grudges against the dentist. Make sure that you are in a good communication way with in good communication with the dentist, and you tell them where exactly you're having the problems, and there is a very high likely chance that the dentist would be able to help you out regarding this. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's causing you discomfort. In case you have any queries, doubts, apprehensions, or insights about our content, please feel free to write it in the comment section, and please make sure you like, share, and subscribe to our videos for more updates. So that's it for today. Thank you.